All right, so in chapter 1, we're going to talk about, this is where they talk about the past and the present phlebotomy in the healthcare setting. You can see the competencies and the objectives here. So way back in the day, in the Middle Ages, there was something called a barber surgeon. And in the 1200s, the guild of the barber surgeons was formed, and they split into two groups: the surgeons of the long robe and the surgeons of the short robe, or as I wrote here, the short rob. The short robe folks were responsible for bloodletting, wound surgery, cupping, leeching, shaving, tooth extraction, and enemas. And that's where phlebotomy finds its roots. The striped pole placed outside or the striped pole you see outside of a barbershop was actually the reason that still is around. Is back in the day they would hang this pole outside with a bleeding bowl suspended from it to signify, hey, we do this stuff in here. And the pole was the rod, represented the rod the patient squeezed to promote bleeding, and the stripes were the bandages that were red and white, and they wrapped all the way around. And the bowl on top, the ball on top of the pole, it represents the bleeding bowls. Pretty cool, huh? So today, though, phlebotomy is much different than it was back in the day. We don't cut you. We don't put leeches on you. We don't do all that stuff anymore. We don't put cups on you. But our purpose for doing it now is for diagnostic purposes. That's how we see you have this illness, you have this, what's going on diagnostically. To remove blood for transfusions, like at a donation center, like the Big Red Bus. Or to remove blood for therapeutic purposes. There are certain disorders that require the removal of blood, and we'll talk about that. And it is done via venipuncture and capillary puncture, which we've done both of in class already. So what are the jobs of a phlebotomist? Besides stabbing people with needles, we have to do all of these things. On page 7, the book tells you a little bit more. But we have to maintain patient confidentiality. We have to transport specimens and make sure that, we keep the specimens stable. We have to collect specimens. We have to make sure we comply with procedures and rules, know how to use point of care instrument, do quality control checks. So it's a little bit more than just stab people. For as far as official recognition for phlebotomy, certification is a voluntary process by which an agency grants recognition to an individual who has met certain prerequisites in a particular technical area. I do have, I haven't updated that paragraph. It says in Angel, my bad. I do have a link, I will link you guys to the course blog that has a whole list of all the agencies, and I do believe I have it somewhere else too, of all the agencies that you can get certified with. It's in your book as well. So certification is different from licensure. Licensure is what is required. If you need license, it's because it's required to legally work. In phlebotomy, we don't require that. California is an exception. They have licensure requirements, and there's a couple other states that have state certification, but in the state of Florida, we do not have any legal certification or licensing requirements, and there isn't even a state exam. So there is no state certification or anything like that in the state. If you want to get certified, there are national certifications. They are not required. They are not part of this program technically, but you are welcome to get them, and you will be eligible to get them when we are done. There's also continuing education credits that you can do that helps you maintain and keep your skills and your knowledge up to date. So, patient interaction. It's very important that we recognize diversity, and we will talk more about diversity actually in class. We also need to demonstrate professionalism, and here are some qualities that make up professionalism. And I do have a supplemental material a little presentation all about different aspects of professionalism, which I'll show you guys that link if you didn't find it already on your own. It's in the resources page. So patients have rights, and they have to be informed of these rights. And in some cases, they even have to sign a statement saying that they've been informed of their rights. The Patient Bill of Rights in Medicaid and Medicare, the Patient Care Partnership, these are all different versions of those kinds of things. You can see that on page 11 from the American Hospital Association. And on page 10, there's a little blurb about confidentiality, HIPAA, protected health information, and healthcare workers. So go check those out and make sure you understand what information they're talking about and how that confidentiality works. I think I have more slides on this, but HIPAA is super duper duper important. Basically, it states that You can't share any information about your patient whatsoever without the patient's explicit permission. All right. Now, certain aspects of care, there's like an implied permission, but that's why patients sign a HIPAA statement whenever they go. So one of the things that they sign on that says that the doctor is allowed to share the fact that you're getting testing done, or the fact that you came to this office to see me, with your insurance company, so your insurance company will pay for it. Okay? But HIPAA, as far as what we want to know about it, it means that we can't tell anybody who we've drawn. We can't tell anybody what tests have been done on anybody. So if your brother's best friend is in the hospital, but your brother doesn't know, and you drew his blood this morning, you can't go home and tell your brother, hey, I saw your best friend in the hospital. That is a violation of HIPAA. Okay? And we'll talk more about this later on if there's not more in this chapter here. All right, so communication skills are very, very important. There's verbal communication and nonverbal communication. When we talk about nonverbal communication, the fancy word for that is kinesics. You want to make sure you don't have too many kinesic slips, and what that means is when your body language doesn't really match what's going on verbally. So if you're saying, I'm feeling great, but you have a super duper frowny face on, that doesn't really work, right? You want to make sure that you are an active listener, that you are aware of communication barriers, and we'll talk about some of those in class too. We want to talk about proxemics, and that's your body's location in space, about how you look, about how we touch patients and what that means. So we'll talk a little bit more about that, but you can read about that in your book, and I definitely recommend it, because these are all things that are going to be the basis by which your communication is how you get your patient to trust you. And if your patient trusts you, then they're going to let you do your job. If they don't trust you, your job becomes a whole lot more difficult. Some of the main elements in effective communication is empathy, control, respect and confirmation, and trust. So do read up on how you can demonstrate those. And we'll do a little exercise in class as well about this. So telephone communication, pretty standard, how to be professional, but you also have to take into account that we also have to comply with HIPAA. So you don't want to get a call from a doctor's office, set that phone down when you have to go look something up, and just not put it on hold, because then they can hear us talking about whatever other patients we may be talking about, and that's not what they called about, may not even be their patient. So we have to make sure that we think about things like that when we're working with the phone. So check out page 15 and look at what that has to say there too. So the healthcare setting, I am not personally going to test you on the financing and billing and CPTs and all that stuff, but you are supposed to know about this healthcare setting and how things are paid for, how they're arranged, how they're organized. So you do need to talk about it. We do need to cover it a little bit. So make sure you read in your book a little bit about this. The healthcare system is changing, and we don't know where it's going to go in the future. We have the Affordable Care Act, also known as Obamacare, that did make some changes occur already. And the goal really is improve patient outcomes and to lower costs. We're not there yet, but that's the plan. The Affordable Care Act was a start, but it certainly didn't really reform health care. It really more reformed health insurance. So we still have a long way to go to change the healthcare system, but you can read a little bit about that in your book. We have managed care. That's the generic term for payment systems. It helps control costs, so they say. They use case managers. They review health services. You've got case management. And then network service systems. You guys can read more and more about this stuff. Hospital is any facility that has permanent inpatient beds, 24-hour nurses, therapeutic and diagnostic services, and an organized medical staff. So anywhere that has those things, even if they don't call themselves a hospital, can be designated as a hospital. So when we talk about the clinical laboratory services, we're talking about the lab. When we go down to the lab, we have different departments in the lab. We have two main areas. We have the clinical analysis area, and we have right here, oops, I didn't mean to click that. We have the clinical analysis area, which has these main departments. That's where we generally work in the most. And then we have the anatomical and surgical pathology area. So we're going to start in the clinical analysis area. These are the main departments of the lab that I've already been talking about in class. You have hematology. This department is going to do tests that are going to look at diseases that are associated with the blood itself and the blood forming tissues. All right. So they're looking at red blood cells, white blood cells, platelets, the whole blood. We don't spin down specimens when we send them. They look at the whole blood, and they look at the blood forming tissue. So they might look at bone marrow and those other blood pre-red blood cell or pre-white blood cell types of cells. Most common test in this department is a complete blood count, a CBC. The specimen tested, like I said, is whole blood, and the specimens go in tubes that are lavender, usually in color, that have EDTA as their additive. Coagulation department is the area of the lab that is going to look at the blood's ability to form and dissolve clots. It's very closely related to hematology. It might even be part of that department, depending on how big or small your facility is. The smaller the facility, the more combined these departments get. They look for defects in the blood clotting mechanisms, and they monitor patients that are taking medicines we call blood thinners. They're actually called anticoagulants, such as Coumadin or warfarin. All right. The two most common tests there are going to be a PTT and a PTT. They test very similar things. PT tests are the ones that are people when they're taking warfarin or Coumadin, the most common blood thinner that patients take. They have to have their blood checked pretty regularly to make sure they're not taking too much or too little, and that's what they'll get here as a PT test. That's usually outpatients will take Coumadin. Sometimes you have them take heparin instead of Coumadin. It's also a blood thinner, but you usually see this, not always, but usually this is more for inpatients. When they're inpatient, they put them on heparin. When they go home, they put them on Coumadin. So if they're on heparin, we're going to test them with a PTT. It's a slightly different test because they work on different paths of the coagulation process. So the specimen that's tested is plasma, okay, which means we do spin down the blood, but it's blood that did not get to clot because it was collected in a light blue top tube with citrate, sodium citrate as the additive. So chemistry department, this is where most laboratory tests are performed. They can have some subsections. They are made up of a lot of computerized instruments that are capable of performing different kinds of tests or panels from a single sample. The most commonly tested specimen is going to be serum, and serum is collected what comes out of blood that has clotted. Okay, so our red tops or our SST tops, right? But they also do test plasma, so that would be like our heparin tubes or our oxalate tubes. Every now and then you'll even see lavender tubes in there with an EDTA specimen, but it gets spun down and they test the plasma in it. But they also test whole blood every now and then. They might test urine or other body fluids too. So if you look on page 25, you'll see some other examples of some tests. So the serology department is also known as immunology. Immunology is the name that more places are wanting to call it now, because serology means the study of serum, and that doesn't really tell you what the department does, whereas immunology is more descriptive of what they do, which is the tests that are done in this department deal with the body's response to the presence of diseases that stimulate what's called an antigen-antibody reaction. Okay, so these are, if you have these disease, you have antigens or antibodies that are going to be present. If you've ever had the chickenpox, for example, your body now makes antibodies against the chickenpox. So you could get a test done in this lab department that would look at your blood. If some of you might have gotten a titer test done, which is going to look at your body's amount of antibodies. So do you have this antibody against this bacterial or viral or fungal disease? So if we're talking about varicella, the chickenpox, they test your blood. They say, yes, she does have X amount of antibodies to the chickenpox. That's how we can determine that, yes, you are immune to that. Or we might say, if say you don't know if you have the chickenpox, we test your blood and you have the antigens present. That means, hey, you have this disease currently in your body. All right. For example, when I was getting diagnosed with my autoimmune disease, because it talks about autoimmune reactions here, I have rheumatoid arthritis. That is an autoimmune disease. So what they did to see if I have this disease was they tested my blood and they looked for a antigen antibody reaction involving the thing called the rheumatoid factor. Rheumatoid factor, and since I tested positive for that, that means I have rheumatoid arthritis. So that's that RF down there. Right here, ANA is pretty common, RPR, so these are your common tests. These usually go in red top tubes, but they can go in gold tops, but for the purpose of our lab, let's just remember red top clot activator. So the urinalysis department, sometimes this can be its own standalone department. Sometimes it can be housed in the hematology or the chemistry departments. It just depends on how big your lab is. These specimens can be analyzed manually and or by an automated instrument. It's pretty routine. They look at the physical composition, the chemical composition, and then they look at it under a microscope to see if there's any crystals or bacteria or other things in there. The most common, we'll talk about that afterwards. Microbiology, that's another department. They're going to look for the presence of microorganisms, and they do that. The test that they do is called a culture and sensitivity, or a C&S. And that tells the type of organism present, that's the culture part, and then the sensitivity tells them the types of antibiotics that would be effective. And there can be subsections of this department too. Blood bank, or as they prefer to be called, immunohematology. This is where blood is prepared to be used for patient transfusions. And the types of specimens, or the types of transfusions, it can be whole blood, it can be platelets, packed cells, fresh frozen plasma, and cryoprecipitates. I don't really know what those are, but all the other ones I can describe better. When blood donations are collected, they're carefully tested for compatibility with the recipient so that we can avoid transfusion reactions. And we will talk more about transfusion reactions, and compatibility, and all of this stuff, blood types and all that, and when we get to chapter 6. So don't freak out too much about that yet. But do look at chapter or page 29 for some common tests. And the tubes for this can be red tops, usually glass red tops, or your larger EDTA tubes, your pink tops. All right, so now we're getting into the other area of the lab. So those were all the clinical analysis areas. Now we're in the anatomical and surgical pathology area of the lab. And you have 3 departments in here. You have histology, which is concerned with looking at the microscopic structure of tissues. Okay, so a pathologist is going to look at these tissues, and these tissues come from surgeries or autopsies, biopsy type of thing maybe. And they're going to look and see if they're pathological. And pathological means capable of forming a disease. Cytology is another department, which is often confused with histology. And cytology looks at the structure of cells. When we get to chapter 4 and you learn your word roots, you'll remember CYT has to deal with cells. So cytology deals with cells, histology deals with tissues. So they identify, count, and look at the cells from the samples, and they look to see if it's malignant or if it's got any kind of issues in it. The most common test, you ladies have definitely heard of this. Some of you guys probably have too. When they do a pap smear, that is a cytology test. Cytogenetics, I didn't ever work anywhere that had a cytogenetics lab. You usually see this in larger labs, but this was where they would look at specimens and for chromosomal deficiencies related to genetic tissue diseases. They're going to look at tissue, blood, or amniotic fluid. They might do DNA histograms, DNA fingerprinting, molecular genotyping, so all of that sort of thing. All right, so other types of labs. You have satellite labs, which are usually specialized, located close to the populations that they serve. They usually have like a test menu that's designed for this particular population. So an example they said was like a stat lab in the emergency department. It's like they just do they have a specific number of tests that they do, and it's good that they do them because they have a fast turnaround time. You also have something called a reference laboratory. That's going to be something like, trying to think of an example locally. They're large independent labs, and they'll receive specimens from other facilities. So, for instance, Parish Medical Center, I know that they get specimens from Parish Home Health. They've got other smaller facilities like some of the nursing homes. They'll collect specimens there, and then they'll bring them into Parish Medical Center and use them as a reference lab. They do stat testing, and turnaround time, though, is a little longer because the specimen is collected off-site and then tested somewhere else. So within the lab, you have your clinical lab personnel. So the top dog is going to be your laboratory director or pathologist. Below them is going to be your lab administrator or your lab manager. Usually you have one or the other, but sometimes you'll have both, although it can get confusing deciding who's really in charge. Then below that, you'll have your technical supervisors, and that's usually of each section. So you'll have like a hematology section supervisor, a chemistry supervisor. They might do it more by like first shift, second shift, but usually it's by sections. Within those departments, you're going to have your medical technologists, your medical laboratory scientists, or your medical laboratory technicians. These are the folks, either the bachelor's or the associate degrees, that are going to actually be the ones running the tests. Then you have your clinical lab assistant, potentially. You may or may not have that. They're somewhere between a 2-year degree person and a phlebotomist. They can do some testing, but not a lot of testing. And then you have phlebotomists, and then you have other personnel as needed. So one of the other things you need to know that your book covers very briefly is the Clinical Laboratory Improvement Act of 1988. And really all you need to know for this particular chapter on this, we talk more about this in Chapter 2, is that the Centers for Medicare and Medicaid Services and the Department of Health and Human Services regulates all sites performing laboratory testing in the United States, not in the United States. Whoops. Click this stuff. It mandates that all labs use the same standards regardless of their size, location, or type, which means that if you get your blood drawn here and tested for a CBC here in Florida, the same standard of how we're going to collect and test that CBC in Oregon is going to be the exact same. We can't change standards just because of where we are. So that means that your results are going to be accurate wherever you're at too. So you can go to this website here and you can look up a little bit more about what the CLIA says. I do believe that that is it, because here's the case study. All right, and we'll do those in class. There's some resources down here you can go look at. And that is it for this particular chapter.